Welcome to our channel. Today, we embark on a journey through the realm of medical vocabulary. Imagine a scenario where clear communication can mean the difference between life and death. In the fast-paced environment of health settings, effective communication is absolutely paramount. Whether it's a doctor conveying vital information to a nurse or a patient describing their symptoms to a healthcare provider, having a strong grasp of medical vocabulary is indispensable. In this video, we'll explore the significance of mastering medical terminology, not only for healthcare professionals, but also for anyone interested in understanding and discussing health-related topics with confidence. From diagnosing illnesses to prescribing treatments, every aspect of healthcare relies on precise communication. And at the heart of that communication lies medical vocabulary. So, join us as we unravel the complexities of medical language, empowering you to navigate the medical world of healthcare with clarity and precision. Let's dive in. Hi everyone, I'm Teacher Minute from CurseAmericas.com, where we help you to level up and show the world the best version of yourself. Through this video, we'll cover a comprehensive range of topics to enhance your understanding of medical vocabulary and its application. By the end of this video, you will be equipped with the tools and knowledge to navigate the intricacies of medical language with ease and precision. So, without further ado, let's get started. Understanding medical terminology. Medical terms are constructed from three key components: prefixes, suffixes, and roots. The root is the foundation of a medical term. It typically indicates the body part or system involved. Let's look at some common roots and their meanings. Cardio refers to the heart. For example, cardiology is the study of the heart and its functions. Derm refers to the skin. Dermatology is the branch of medicine dealing with skin conditions. Neuro refers to the nerves or nervous system. Neurology is the medical specialty concerned with the nervous system. Hemo or hemato refers to blood. Hematology is the study of blood or blood disorders. Osteo refers to bones. Osteoporosis is a condition characterized by weakened bones. Pulmo refers to the lungs. Pulmonology is the medical field focusing on the respiratory system. By identifying the root, we can often determine the body part or system the medical term refers to. Let's practice with a few more examples. Hepato refers to the liver. Hepatitis is inflammation of the liver. Nephro refers to the kidneys. Nephrology is the study of kidney function and diseases. Myo refers to muscles. Myopathy refers to a disease of the muscle tissue. Encephalo refers to the brain. Encephalitis is inflammation of the brain. Prefixes. Prefixes are added to the beginning of a root to modify its meaning. For example, hyper means excessive or above normal. So, hypertension refers to high blood pressure. Let's explore more prefixes with examples to see how they change the meaning of the roots that they are attached to. Hypo means below normal. For instance, hypoglycemia refers to low blood sugar, with glyco meaning sugar and emia meaning blood condition. Brady means slow. Bradycardia refers to a slow heart rate, with cardio meaning heart. A or an means without or lack of. Anemia means a lack of blood, with emia referring to a blood condition. Dys means abnormal or difficult. Dysphagia refers to difficulty swallowing, with phagia meaning swallowing. Poly means many or much. Polyuria refers to producing an abnormally large volume of urine, with urea meaning urine. Suffixes. Suffixes are added to the end of a root to modify its meaning or indicate a condition, procedure, or disease. For instance, itis indicates inflammation, so bronchitis refers to inflammation of the bronchial tubes. Ectomy means surgical removal. Appendectomy is the surgical removal of the appendix, with append referring to the appendix. Oma means tumor or mass. Lymphoma refers to a tumor of the lymphatic system, with lymph indicating the lymphatic system. Scopy means visual examination. Endoscopy refers to the visual examination of the interior of a body organ, with endo meaning within. Algia means pain. Neuralgia refers to nerve pain, with neuro indicating nerves. By breaking down medical terms into these components, we can decipher their meanings more easily. Basic medical vocabulary. Now that we understand the structure of medical terms, let's dive into some common medical terms related to anatomy and physiology. These terms are foundational for anyone involved in medical healthcare or studying medical science. Let's start with the basics of the human body. Here are some key terms related to different body parts and systems. The cardiovascular system. Heart, cardio, the central organ of the cardiovascular system. For example, cardiology is the study of the heart. Blood vessels, angio, includes arteries, veins, and capillaries. Angioplasty is a procedure to improve blood flow through the artery. Vein, phlebo, or veno. For example, phlebitis is inflammation of a vein. Respiratory system, lungs, pulmo, essential for breathing. Pulmonology is the study of lung conditions. Airways, broncho. For example, bronchitis is inflammation of the bronchial tubes. Digestive system, stomach, gastro, involved in digestion. Gastritis is inflammation of the stomach lining. Liver, hepato, vital for detoxification. Hepatitis is inflammation of the liver. Intestines, enectro, small and large intestines. Enteritis is inflammation of the intestines. Nervous system, nerves, neuro, transmit signals throughout the body. Neuropathy refers to nerve damage or disease. Spinal cord, myelo, conducts signals between the brain and the rest of the body. Myelitis is inflammation of the spinal cord. Musculoskeletal system, bones, osteo, provides structure and support. Osteoporosis is a condition where bones become weak and brittle. Muscles, myo, enables movement. Myopathy refers to muscle disease. Joints, arthro, connects bones and allow movement. Arthritis is inflammation of the joints. Integumentary system, skin, dermato, protects the body. Dermatitis is inflammation of the skin. Hair, tricho, for example, trichology is the study of the hair and scalp. Nails, onycho, for example, onychomycosis is a fungal infection of the nails. Urinary system, kidneys, nephro, filter blood and produce urine. Nephrology is the study of kidney function and diseases. Bladder, cystro, stores urine. Cystitis is inflammation of the bladder. Reproductive system, uterus, hystero or metrio. For example, hysterectomy is the surgical removal of the uterus. Ovaries, ophoro. For example, oophorectomy is the surgical removal of an ovary. Testis, orchia. For example, orchitis is inflammation of the testis. These terms are just the tip of the iceberg, but they form the foundation of medical vocabulary related to anatomy and physiology. By familiarizing yourself with these terms, you can better understand medical documents, communicate with healthcare professionals, and even manage your own health more effectively. In the next segment, we'll explore essential vocabulary for describing symptoms and medical conditions. Stay tuned to build your medical vocabulary further. Let's start with common symptoms, which are signs of illness or injury that patients experience and report. Pain, acute pain, sharp, severe pain that comes on suddenly. For example, acute abdominal pain can be a sign of appendicitis. Chronic pain, persistent pain that lasts for weeks, months, or even years. Chronic back pain is a common condition. Localized pain, pain confined to one area of the body. Localized chest pain can indicate a heart problem. Radiating pain, pain that spreads from a central point to other areas. Inflammation and swelling. Edema, swelling caused by excess fluid trapped in the body's tissues. Ankle edema can result from an injury or a medical condition. Erythema, redness of the skin due to increased blood flow. Erythema is often seen in skin infections or allergic reactions. Respiratory systems. Cough, a reflex to clear the airways of mucus or irritants. Chronic cough can be a sign of bronchitis or other lung conditions. Wheezing, a high-pitched sound during breathing, often indicating narrowed airways. Wheezing is common in asthma. Gastrointestinal symptoms. Nausea, a feeling of sickness with an inclination to vomit. Nausea can be caused by various conditions, from motion sickness to infections. Diarrhea, frequent loose or watery bowel movements. Diarrhea can result from infections, food intolerances, or other digestive issues. Constipation, difficulty in passing stools. Constipation is a common digestive complaint. Neurological symptoms. Headache, pain in the head or upper neck. Migraine is a severe form of headache with additional symptoms like nausea and light sensitivity. Dizziness, a sensation of spinning or losing one's balance. Vertigo is a specific type of dizziness related to inner ear problems. Seizures, uncontrolled electrical activity in the brain, causing changes in behavior, movement, or consciousness. Epilepsy is a condition characterized by recurrent seizures. Cardiovascular symptoms. Palpitations, a sensation of a rapid, strong, or irregular heartbeat. Palpitations can be caused by anxiety, heart conditions, or other factors. Chest pain, pain or discomfort in the chest. Angina is a type of chest pain caused by reduced blood flow to the heart. General symptoms. Fever, an elevated body temperature, usually indicating an infection. High fever can be a sign of a serious illness. Fatigue, extreme tiredness or lack of energy. Chronic fatigue can be associated with various medical conditions. Weight loss, unintentional loss of weight. Unexplained weight loss can be a symptom of conditions like cancer or diabetes. Next, let's move on to some common medical conditions and their meanings. Infections. Pneumonia, an infection that inflames the air sacs in one or both lungs, which may fill with fluid. Urinary tract infection, UTI, an infection in any part of the urinary system, including the kidneys, bladder, or urethra. Chronic diseases, diabetes, a condition that affects the body's ability to process blood glucose. Type 1 diabetes is where the body doesn't produce insulin, and type 2 diabetes is where the body doesn't use insulin properly. Hypertension, high blood pressure, which can lead to serious heart problems like heart disease or stroke. Autoimmune disorders. Rheumatoid arthritis, a chronic inflammatory disorder affecting many joints, including those in the hands and feet. Lupus, an autoimmune disease where the body's immune system attacks its own organs and tissues. Cardiovascular conditions. Heart attack, myocardial infarction, occurs when blood flows to a part of the heart that is blocked for a long enough time that part of the heart muscle is damaged or dies. Arrhythmia, an irregular heartbeat, which can be too fast, too slow, or erratic. Respiratory conditions. Asthma, a condition in which your airways narrow and swell and may produce extra mucus, leading to difficulty breathing. Chronic obstructive pulmonary disease, COPD, a group of lung diseases that block airflow and make it difficult to breathe. Neurological disorders. Parkinson's disease, a neurodegenerative disorder that affects predominantly dopamine producing neurons in a specific area of the brain called substantia nigra. Multiple sclerosis, MS, a disease in which the immune system eats away at the protective covering of nerves, causing communication problems between your brain and the rest of your body. Mental health conditions. Depression, a common and serious medical illness that negatively affects how you feel, the way you act, and the way you think. Anxiety disorders, a group of mental disorders characterized by significant feelings of anxiety and fear. These are just some of the essential terms you'll encounter in the medical field. Knowing these can help you describe symptoms more accurately and understand medical conditions better. In this segment, we'll cover medical abbreviations and acronyms. These shorthand forms are used frequently in medical records, prescriptions, and communication between healthcare professionals. Understanding these can greatly enhance your ability to navigate medical documents and discussions. Let's start with some common abbreviations and acronyms you might encounter. Vital signs. BP, blood pressure. This measures the force of blood against the artery walls. HR, heart rate. This measures the number of heartbeats per minute. RR, respiratory rate. This counts the number of breaths a person takes per minute. T, temperature. This measures the body's temperature. Common measurements. HT, height. WT, weight. BMI, body mass index, a measurement that uses height and weight to estimate body fat. Medications and prescriptions. RX, prescription. OTC, over the counter, refers to medications available without a prescription. BID, twice a day, used in prescription instructions. TID, 3 times a day, used in prescription instructions. QID, 4 times a day, used in prescription instructions. PRN, as needed, often used for medications only taken when necessary. Medical conditions. DM, diabetes mellitus, a group of diseases that result in too much sugar in the blood. HTN, hypertension, another term for high blood pressure. CAD, coronary artery disease, a condition involving narrowed or blocked coronary arteries. CHF, congestive heart failure, a condition where the heart's ability to pump blood is inadequate. COPD, chronic obstructive pulmonary disease, a group of lung conditions that cause breathing difficulties. Diagnostic tests and procedures. CBC, complete blood count, a blood test used to evaluate overall health and detect a variety of disorders. EKG or ECG, electrocardiogram, a test that records the electrical activity of the heart. MRI, magnetic resonance imaging, a test that uses powerful magnets and radio waves to create detailed images of the body. CT or CAT, computed tomography, a type of imaging that uses X-rays to create detailed pictures of the inside of the body. X-ray, a common imaging test that uses electromagnetic waves to create images of the inside of the body. Now let's do a fill-in-the-blank challenge. I'll give you a sentence with missing medical terms or abbreviations. See if you can fill them in correctly. Sentence 1. The patient has high BP and needs to take medication, TID. Blood pressure, 3 times a day. The patient has high blood pressure and needs to take medication 3 times a day. Sentence 2. The patient is scheduled for an MRI to examine potential brain pathology. Magnetic resonance imaging. The patient is scheduled for a magnetic resonance imaging to examine potential brain pathology. Sentence 3. The doctor noted the patient has a history of HTN and DM. hypertension, and diabetes mellitus. The doctor noted the patient has a history of hypertension and diabetes mellitus. Congratulations on completing our journey through English for health and medicine. We've covered a lot of ground, from understanding the structure of medical terms to deciphering acronyms and abbreviations. By now, you should feel more confident navigating medical documents, communicating with healthcare professionals, and understanding your own health better. If you found this video helpful and informative, I encourage you to subscribe to our channel for more language learning content like this. By subscribing, you'll stay updated on our latest videos and continue to expand your knowledge. If you want to learn more, go to our website, chrisamericas.com. I will see you in the next video. Bye.